Hello everyone. Common chief complaints in neonatal history we find feeding difficulties, vomiting, then we have to differentiate vomiting and regurgitation. Failure to pass stool. We should know that normally baby pass stool in 24 hours. So parents are not aware about this, so they are generally coming with this complaint also. Baby is already having the 6 hours of life, is still not past the stool, so we have to counsel and reassure them. Failure to pass urine in 48 hours. It is also a very common complaint. Then again, we have to counsel them that normally newborn pass urine in 48 hours. So after 48 hours, we have to do the intervention. Before 48 hours, it is the normal physiological range for the pass of urine. Then sometime constipation and loose stool. Again, we have to reassure them because newborn babies are having the different GI transit time. So sometimes they pass the stool once in a week. It is also normal. And sometimes 10 to 12 times in a day. It is also the normal. But we have to differentiate either it is the normal physiological or is it pathological. So for loose stool, we have to differentiate, is it the gastrocolic reflex or is it the neonatal diarrhea? I will tell you in next slide how to differentiate the common physiological findings with the pathological. Yellow discoloration of skin, because we know physiological jaundice present in 60% of normal healthy term babies and 80% of preterm babies. Hiccups, sneezing, yawning. Sometimes parents are coming with these complaints also. So this is the normal finding. And fever, skin rashes can be there. So we have to differentiate what is the etiology of fever and skin rashes, either physiological, as I have discussed in the previous neonatal skin disorder slide. Various benign neonatal conditions are also there. Sometimes parents are coming with the complaint of excessive crying. So we have to differentiate, is it the normal cry or excessive cry. So whenever baby is crying for more than 3 hours continuously, not consolable, then we label the excessive crying. Otherwise, baby normally cry whenever hungry or pass urine or stool, or whenever there is a environmental temperature is not comfortable for the baby. Eye discharge, again common in newborn period, either because of conjunctivitis or because of nasolacrimal duct blockage. In first 2 to 3 weeks of life, newborn is not having any tear. So whenever there is a watering or secretion from eyes, we have to suspect either conjunctivitis or NLD blockage. Excessive sleepiness is again a common complaint by the parents. So we have to explain them that newborn babies sleep for 18 hours normally, hardly wake for 6 hours, only for feed after every 2 hours and whenever pass urine and stool. Vaginal bleeding and secretions are common in female newborn baby because of maternal hormone in first week of life. So again we have to reassure them. Scalp swelling, asymmetrical head shape is again the common complaint. I will tell you in detail in next video. Congenital deformities are also common in newborn. So we have to first examine and according to the different deformity we have to give the treatment or advice. After ODP, we have to take the history of present illness. So just take the example of vomiting. So first we have to write down the onset. Onset is acute, subacute or chronic. Then we have to write down the duration of vomiting, since how many days. Then progression, is it non-progressive or progressive? Example, if baby is having vomiting since last 3 days, then since onset baby is having 2 or 3 episodes in a day, then we will say it is non-progressive. If on first day hardly 2 episodes and third day patient is having 7 or 8 episodes, that means it is progressive. Then write down the frequency of vomiting, then associated with nausea or not. Then about the vomitus, its color, content, is it bile stained or even the fecal matter is present. Example in intestinal obstruction, we have to differentiate the what is the level of obstruction by these points. Then interval between vomiting and given feeds will give us the clue about the etiology. Then also see the activity and look after vomiting. So we will be able to differentiate is it regurgitation or actually vomiting. So regurgitation is the passage of gastric content into the oral cavity and some time out of the mouth. It is a physiological condition present in newborn period and generally persists up to 4 months of age. Very rarely in very few patients it can even persist up to 2 years of age. Vomiting is the forceful expulsion of the gastric content through the mouth. And in vomiting we know there is an intense muscular activity of the respiratory and abdominal muscle, and it is centrally mediated somatic reflex response, and vomiting is always pathological. Clinically, we can differentiate regurgitation and vomiting. In regurgitation, baby is healthy, looking well, and gaining weight normally. While in the vomiting, there will be sick look, baby will not gain the appropriate weight, so we can differentiate. Now take the another example, loose stool. So again we have to ask the onset, duration, progression, then frequency in a day, then associated with the abdominal distension or not, we have to write. Then about the stool color, consistency, is it blood or mucus stained, we have to ask. Then interval between the feed and passing stool. So it is again we have to differentiate gastrocolic reflex from neonatal diarrhea. So in gastrocolic reflex, which is a physiological finding, whenever mother will give the feed to the baby spontaneously, either during the feed or at the end of feed, baby will pass the stool. So when milk will be entered into the gastric stomach, this reflex will start and colonic movement will start and baby will pass the stool. Then also ask the urine output is adequate or not, because we know normally newborn should pass the 6 to 8 times urine in a day. So whenever with the loose stool urine output is less, that means baby is having the neonatal diarrhea, and this is the sign of dehydration. And also check the weight gain with loose stool. So again we have to differentiate, is it the gastrocolic reflex or neonatal diarrhea? So gastrocolic reflex is a physiological reflex, and in this colon is stimulated immediately in response to the stretch of stomach with every feed. Increased motility is there. So it is around 10 to 12 times in a day. So whenever mother will give the feed, baby will pass the stool. This condition also persists up to 4 months of age. It is physiological. Now in the neonatal diarrhea, baby will have the watery, very loose stool. There is no relation with the feed, and baby will have the crying due to the cramping with the diarrhea. So pain abdomen will be there. Again clinically we have to differentiate. In gastrocolic reflex, baby will look healthy, well, normal urine output will be there. There will be no sign of dehydration and appropriate weight gain will occur. While in the neonatal diarrhea, sick look, decreased urine output, signs of dehydration, baby will not gain the weight. So this is also asked in the Viva, how to differentiate physiological and pathological conditions. Thank you so much.